Hi friends, welcome back to my channel. I'm Lavanya from Sweden. Today's topic is the maternal care in Sweden and my personal experience giving a birth to a child. Depending on the length of the video, whether I take a complete video on my experience as well as how the system works in Sweden. Otherwise, I would like to split into part 1, part 2. I don't want to take it length and boring. So yeah, I want it to be informative instead. I will start with how the system works here, the maternal system works in Sweden. As a woman, when you conceive, you have to contact your registered ward central. Ward central is a clinic here. The regular clinic where you go to the hospital when you are sick, like a fever and etc. That is ward central. MVC is different. Maternity ward central is only to take care of the pregnant woman. That's a difference. So usually once you conceive, you have to contact your nearby MVC or any MVC they will redirect you to the nearest MVC. If you don't know how to contact MVC, you have to contact your registered ward central. So once you contact MVC, they will give you a date. It's only on the phone, and they will check the schedule and they will give you a available date and time to have a first meet with the midwife. Of course, they will prioritize the pregnant woman here. So again, here how the system is, you will be meeting mostly midwife, not the doctors, unless until you have any complexity. For the scannings, of course they have a different doctors, but the regular visits, regular follow-up, and if you don't have any complexities about your baby's development or your own self, then you'll be meeting only midwife. Doctors come into the picture when only you have any complexities. What is the difference between midwife and doctors here? um, Doctors are authorized to prescribe any medicine, but not midwives. But any other test and follow-ups, how the baby growth and your own health and everything, only midwives. They're almost equally knowledgeable like doctors. It's only that I asked a midwife what's the difference. She told me that this is the one thing, they are not authorized to prescribe any medicine. So if you have a complexity, came up something in the test they have taken, then midwife will be contacting the doctors, and then doctors will suggest prescribe some medicine. And again, you will not meet the doctor here directly. If it is only done by midwife doctor contact, they will contact each other, and doctor just will prescribe it, and midwife will tell you that you have to use this particular medicine. That is all. So once you meet up your midwife first time, so she will do the basic checks, maybe with the blood sample and everything. Usually they don't do any pregnancy test. They didn't do me for me in both the cases. I have 2 childs now. Here I gave both birth here only. So they just go on your words that your pregnancy test is positive. They may ask you to come in the 3rd month, I think first meet, and then first scanning also. So that time they'll scan your baby, and they see how the baby's development is, and based on that they may prescribe iron levels if they are low. Otherwise there's nothing like general medicine like we have in India. Usually we have a bunch of medicine that you'll start once you conceive. No, there's nothing like that unless some blood tests show that you have some deficiency. Then only midwife or doctor prescribe to use some medicine. Usually most of the women will get in iron deficiency in somewhere one of the trimester of your pregnancy. The midwife schedules the upcoming meets with her. Mostly, yeah, the ladies are midwives here, I have seen. Yeah, you may find like rare gents as midwife. So yeah, she may schedule upcoming till wherever she can find. She can give you the schedules to meet up her. But if you have anything to talk in between the schedules that you want, we had to meet up, you can write a text on the particular MBC you are going there, and you can they will reply you or call you accordingly, according to your complexity of your concern. As I said, if there is no complexity, like about the uh, baby development, or if you have any serious, very low iron levels, or if you're pregnancy diabetic, or yeah, any such kind of complexities, you will not have a every month checkup. Otherwise, if you have any of these complexities, then you will meet up every once in a month midwife. Otherwise, I think it's third month, then after a couple of months, like that. But once you finish second trimester, I think third trimester is where you have regular checkups every month, maybe scanning every month scanning, and the last month you will have, I think, visits every couple of weeks. This is if you don't have any complexities. If you have seen, if the midwife has seen any complexities in your baby's growth, or with your hormone levels or iron deficiencies, anything, then she will ask you to come every month for scanning. And if required, in between, there may be a video calls with her. I think before pandemic it was less of video calls, but during pandemic they have increased of having a video calls to reduce contact. After pandemic also they have continuing with the video calls wherever possible. But if you have to meet up every month, as I said, every month or every meet, you will have, they will take blood samples like iron, hormones, and urine samples and everything, and the weight, and the regular hand. The midwife uses her hand on your stomach to check the baby's movement or the size of the baby, by measuring your stomach size and everything. So these have to be done physically. So when these have to be done, you have to go on personally to meet her. Otherwise, if she just have to follow up how you're doing, and anything you're feeling, especially not well or something, then she will be having some follow-ups in between with video calls. This is about the physical care. When I say physical care, about your baby's development and about your body, how is it developing, and the weight, etc. And they also talk about mental health as well. That is one good thing here. So the midwife, I think when you finish, or finishing your second trimester, she'll start asking you how you're feeling mentally. Even I think they'll start from the beginning itself, how you feel and everything, but especially about delivery, how you want to deliver your baby, and how are you feeling about giving a birth to a child, and the hospital environment, what do you want to know, how you want to give your birth, all these questions she'll discuss with you. So it's like, again, you can choose to have a C-section here, but it's very common. Midwives recommend to give birth normally. So if you're really weak, or if you're scared of giving birth to a child normally, then you can opt for C-section. Otherwise, most of the cases it will be natural. They'll encourage you to give a natural birth. As I said, some women may be weak mentally, that they are very scared about labor and everything. Then they can talk to midwife. They really want a C-section. Then I think they'll go with the C-section. This is one thing they will discuss. And also your mental health. As your body grows with your baby, the weight, and of course your hormones change, your moods change, lot of things happen. I know most of the women every woman who gave birth to child know these things. So lot of changes happen to your body, physically and mentally. So everything they'll discuss. You can talk openly. You can just speak your mind, whatever you're feeling about your body, about your mental health, anything happening at home, whether you're getting support or not. So they'll discuss everything. You can openly talk to your midwife so that they will help you in whatever way they can. It's very important here in Sweden. The woman who is pregnant have to have a pleasant environment at home. So your husband or your family, like mostly it will be a husband, because it's a not a joint families here usually. So yeah, your husband should be supporting, and the environment at your home should be like peaceful. They'll also discuss how you want to give a birth to a child. When I say how, here you have options. So you can give a birth in a hospital, or you want to give a birth in your home. That is also possible. You can opt for it. And there is a option called giving a birth in a water. There are a couple of things. I think I don't remember exactly, but I have read and heard. Yeah, but you have options to choose with midwife. Even these things you can discuss with her. So once you reach your third semester, and maybe in the last month, after 36 weeks, you have like every couple of weeks, if required, every week, you have to meet up, and they will ask you to be ready, and they'll discuss about the contractions and about the fake contractions versus real contractions, and when you have to go to the hospital. It's not like here you have to call initially, and then depending on your the complexity of your contractions, they'll ask you to come or to stay at home. They'll also discuss how you want to have, or maintain your labor. I mean, like you want epidural to decrease your labor, or you don't want any epidural. Epidural is like where they will give you an injection, or a kind of, they will inject some medicine into your cell line, so that you don't feel much of contractions, but still you will have contractions to give. If you're a woman who feel that you can't bear labor, and then you can ask for epidural so that the labor will be less. Otherwise, the first option is the nitrogen gas, which I was preferring. So it's the gas, it just a diversion. Once you have your nitrogen oxide inserted to your mouth, you initially, when you have a less contracts, you get a laugh, and once your contractions become severe, you may feel less of contractions, because as much as you feel, you insert the nitrogen oxide, your body goes numb, so your contractions will be felt a bit less compared to the without nitrogen oxide. Otherwise, if you are really feeling the contractions are very high and you're not able to bear at all, or if your water is broke, such kind of complexities, or you're bleeding unnaturally, then you have to go to the hospital directly. When it comes to delivery, in at least in Gothenburg, there is only one big hospital with a lot of buildings. Only there the woman will give a delivery. Other like what central MVCs, I told, like you have a regular checkups till the delivery date, but delivery will be done in a particular hospital only. So once you have reached the day has come, the big day, and once you go there, the midwife will take all the measurements and the basic test and everything, and then they will give you a room, separate room. Some rooms will have a single bed, and some rooms will have a couple beds, depending on how many people are delivering on that particular day, the day which you are delivering as well. So you may get a single room for you itself, the entire room for you, or maybe a couple of you and another woman will be there in the same room, and it will be admitted. So yeah, based on the contractions, they will make every equipment ready, and at least 2 to 3 midwives will be ready for you to take care of you. and they keep watching your BP levels and how the baby's blood pressure and everything, all the like measurements. So depending on what you choose, how you have chosen to give delivery, they will make the arrangements accordingly. I think in the hospital you may have to if it is normal delivery and no complications, and if you are comfortable you can just go home in the same day if it is morning, and maybe you can go in the evening depending on completely you're comfortable. So if there is any complexity of delivery or you're not comfortable going, or a baby has some complications and she has to put in some special care, then you have to wait. Otherwise I think you can go on the same day. So definitely it's up to you. You can ask if you are comfortable staying there or you want to go home. And if you're staying, and they will teach you, I mean they will teach you how to feed. If you have chosen to breastfeed your baby, they will help you to how to breastfeed your baby, and all those things they will teach you. Any other questions that you have to take, how to take care of your baby or yourself, anything, they will explain you very well. um, yeah, the midwives in the hospitals, they have different shifts, so you may end up seeing in multiple midwives in different shifts, but all the midwives take care of you very well here. Yeah, I think I'll take the part 2 video for my experience giving a birth in Sweden. See you guys. Please like this video if you enjoyed, if you have got enough information. Share it with friends and subscribe to my channel. Thank you. See you soon.